What's up, everybody? It's Dr. Dylan from Apex Spine and Sport. I realize my sign is written backwards. I don't care if today we're talking about the top 3 sports injuries. In fact, that's going to be for the duration of the month. That's our theme. Top 3 sports injuries that we see, treat, and help athletes with or patients with to keep them in the game, keep them active, get back to the field and or court. Number 1 injury that we're going to address today is concussions, especially with football having started. If you don't know, concussions have become a really hot topic in the NFL and college. High school has taken part of that as well. That's why you'll see those little bubble-wrapped helmets. If you've seen those floating around and other things, they tend to do an all right job to give a little extra precautionary measure. But I tell you what, here's what happens when a concussion occurs. So you've got your skull. Inside, of course, you've got your brain. And between your brain and your skull, you've got this fluid. So your brain is essentially floating there. And when you get your bell rung, or there's a big enough football hit, or any sport in it for that matter, but your head hits something hard enough, your brain actually runs into your skull, and then there's a little injury that happens there. The problem is if you have multiple concussions, there can be injuries throughout your brain, not just where it hits, and that can lead to a whole bunch of different things. In the NFL, you've seen players not be able to play anymore. Their cognitive ability is affected. They can't think, they can't speak, they can't. Their motor function changes as well. And unfortunately, we've lost some of those players, which phone just fell. Anyway, which is pretty sad. And of course, we don't want to see any of that. The cool part here in our office is that we've got a protocol. So we use chiropractic adjustments of the neck. We do acupuncture, and then we also got laser. The coolest part, and maybe the secret sauce in there, is the laser. So we actually do laser on the head and brain to front load your body with all of those preventative measures, natural healing agents that your body already produces. And so we treat the head and the brain with the laser, so the body can already be prepared that if it did take a hit or you got your bell rung, that it would be ready to deploy those agents and get your body better faster. Anyway, so today it's concussions. Look to next week, we're gonna talk about ankle sprains. The following week, we're gonna talk about knee pain. But this month is all about the athletes, the sports injuries, because we know sports are back in session for school. If you have an athlete, especially a football player, you've gotta be having that treatment done so they don't have any concussions this season. Give us a call, send us a text message, or book an appointment online. It's easy. Our receptionist, Crystal's amazing. She's happy to help. Thank you. Look forward to seeing you.